Case history, kidney transplantation. So the patient name is Jason. He's 35. He complains of swelling of the legs, lower extremities. His urine is cloudy, red, and had a decreased urine output. And he also feel pains when passing urine. And for history of present disease, he came to the hospital 3 months ago and is has been diagnosed with glomerulonephritis, and the patient condition got worse and developed chronic renal failure. So the patient is undergoing dialysis 3 times per week and waiting for kidney transplantation. Luckily, his brother is willing to donate his kidney to him. So for past health history, he had diabetes mellitus and taking insulin injection. He has hypertension and is taking medicine for that. And for general inspection, his condition is middle grade. He looks older than his age, and for he had a pain face. He is very underweight of a BMI of 17.3. For his skin, he has pale skin. To go is decreased. The skin is dry. Mucous membrane is dry. There's brittle in the nails. Hair is also brittle, and he had presence of edema on the lower extremities. And for muscular system, there is muscle wasting, and he also has poor muscle strength. And next, his respiratory system is not compromised. Cardiovascular system, his apex beat has been shifted to the left, and his heart rate is 120 tachycardia, and he had a blood pressure of 140, hypertension. And for percussion, we see that the left relative cardiac dullness shift to the left, means that there is hypertrophy of the left ventricle. Auscultation, everything normal. And for peripheral vascular system, everything seems to be normal. In conclusion, the patient has hypertension, tachycardia, and the CVS is compromised. So, and then the peripheral vascular system is not compromised. And plain chest X-ray and ECG also need to be done for further investigation. For GIT system, everything seems to be normal. And GIT, in conclusion, GIT is not compromised. For genitourinary system, it is compromised. There is during inspection there is swelling of the lumbar region, and also during percussion the Paterno's key sign is positive. And so we need to do renal biochemical test, urine test, and also ultrasound of the kidney. So for laboratory and instrumental examination, complete blood count, we seen there is a decrease in hemoglobin, RBC, and hematocrit. This means that there is an elevated there is decrease in there is anemia. And for blood chemistry, we seen an elevated increase in glucose, means that this is because patient is associated with had diabetes mellitus. And patient potassium levels are also elevated, suggests that there is may occur impaired kidney excretion. And patient creatinine levels is also elevated, means suggests that there is reduced glomerular filtration rate and impaired kidney function. For urine analysis, we see that the color of the urine is red, and it is cloudy, and there is presence of blood and also presence of traces of protein. uh, so these results may suggest ongoing kidney damage. And we also did blood typing. His blood is type 1 and rhesus positive. For instrumental test, his chest X-ray is normal and ECG also normal. And for ultrasound of the kidneys, it's a typical picture of glomerulonephritis. So final diagnosis of the patient had chronic kidney failure due to glomerulonephritis or due to diabetes mellitus and hypertension. So preoperative epicrisis, date of operation is on the 3rd of December. So final diagnosis, clinic failure. The surgical operation is urgent. The procedure done is heterotopic kidney transplantation. Indication is elective surgery. Contraindication is diabetes mellitus. The risk of surgery is high. Risk of thromboembolic complication is high. Risk of bleeding high. Type of anesthesia, general inhalation anesthesia, halothane. We've given him informed consent. The patient has been signed. And for preoperative examination, preoperative examination, preoperative checklist has been done at 11 a.m. and uh, we have shaved the area at 11:20 p.m. a.m. and the operation is done on 1:30 p.m. and ended at 4 p.m. and throughout the operation we monitored his vital signs, pulse, respiratory rate, blood pressure and also temperature, and the patient is given a intravenous access and also Foley catheter to calculate the volume output, urine volume of urine output. So during the post-operative care of first day, patient's blood pressure is 135, elevated for 3 hours, and after 3 hours, patient blood pressure dropped from 135 to 130, and the patient's skin is pale, and after 3 hours become normal, and patient Glasgow Coma scale is 9 after surgery, and it is increased to 14 after 4 hours, and patient is on a strict NPO diet, and the urine observation, the color of the urine that is cloudy, and there's also presence of blood on the urine. The volume of urine output is 1,000 milliliter. For the state of dressing, it is moderately wet, and the stitches under the bandage are well developed without signs of inflammation. The dressings are changed every 2 hours. So for post-operative medical chart, we given him morphine for the first 24 hours, and then ceftriaxone injected intravenously one time. This is for antibiotic therapy, and cyclosporin immunosuppressant drug. This is for prevention of rejection of the organ. This is given 20 milligrams orally, and enoxaparin subcutaneously 40 milligram. This is to prevent thromboembolic complication. So post-operative fluid chart, we've given him dextrose 5 solution of 1,200 milliliter, dextrose 5 solution, and also lactate ringer solution of 1,200 milliliter throughout the day, where we minus the volume of urine output, that we achieved a balance of 200 milliliters fluid. So post-operative care day 2, we've seen that the blood pressure throughout the day is 130, and then after in the evening it decreased until 120. So the patient blood pressure has been stabilized, and the skin is all normal. The site, there's no hemorrhaging, the dressing is normal, it is dry and clean. The dressings are now changed once a day. Patient at the evening can eat, no more NPO. And for urine observation, patient on the morning is cloudy, and throughout the evening it is transparent. For blood, there is presence of blood on the urine on the morning, and at the evening it is not present. And for medical chart, we've changed from the morphine to ibuprofen intravenously, and ceftriaxone, cyclosporin, and enoxaparin. And the fluid chart, dextrose 5 solution and lactate ringer solution, 1,200 milliliters, and total volume urine output is 600 milliliters. So on the second day, we achieved positive 600 milliliter balance of fluid. So on the third day, we've seen the same clinical picture: stabilized blood pressure, no the dressing is dry, no signs of inflammation in the dressing, and the urine character, there's no more cloudy urine and also blood on the urine. And for for the medicine is the same as second day. For fluid chart, it on the third day we achieved a minus 200 milliliter of fluid. So in the operation, it is estimated that the fluid loss is 600 milliliters, and of this our infusion therapy, we managed to correct the fluid loss. So next is the laboratory result. In the laboratory result, it is good. the hemoglobin, red blood count, and hematocrit levels is in the normal range. His creatinine level is also in the normal range, and for urine analysis, the character is now normal, yellow, clear, and no more blood and no more protein traces. So due to these parameters, we can say that the kidney is now functioning and healthy, the transplanted kidney. And the patient is recovering, and there is stability in the blood pressure, as hypertension is common in the post transplant, and now it is stable. And there is no rejection of the kidney, and the kidney is functioning. So that is it from me. Thank you.